Good afternoon, I am Dr. Murli, SR, General Surgery Department, RMC Loni. Today we have finished the online test 3 in surgery and orthopedics. Let's see the feedback in these questions. First question, chest physician performs bronchoscopy in the procedure room and he is asking for the sterilization mechanism for an immediate usage. The answer option is given by 196 students, which is a very good to see that glutaraldehyde sedex, which is known as, that is the right answer. And second question, in a surgical post-op ward, a patient developed wound infection. What is the best way to prevent this infection? Proper hand washing by all the ward patient, all the ward personnel, those are working in the ward, like sisters, brothers, everything, technicians and all. And that is given by 97.5% of the patient students, which is a good answer. And next question is indicator of hypoperfusion and severe sepsis, which was correctly answered by 185 students. Systolic BP less than 90, lactic acidosis and oliguria, all the above. Ideally, when should antibiotics given to a patient during a surgery? It is at the time of induction, not at the time of incision, because at the time of incision, the antibiotic should already be circulating. So, best time is at the time of induction. Good answer. Preoperative shaving is ideally done at just before the operation, which is answered by 173 students, 86%. That is the right answer. Best management of contaminated wound with necrotic material, 98.5% of the students answered it right. Yes, debridement is the right answer. Gas gangrene is caused by, all of them answered. Clostridium perfringens, right answer. Ramesh met an accident with a car and has been in deep coma for 15 days. Most suitable route for administration of protein and calories, because the enteral system is intact, jejunostomy feed tubing will be the best. TPN is indicated in all except. TPN is not indicated in sepsis because it enhances the septic condition when TPN is given to the condition which does not cause metabolic acidosis. Pyloric stenosis causes alkalosis. So here it was asked as which does not cause. So pyloric stenosis is the answer, which is answered by a good number of students. In a patient with multi-system trauma, presence of hypotension along with elevated CVP is suggestive of. Answer is cardiopulmonary problem. So which is answered by around 92% of the students. Which among the following is best method to assess the intake of fluid in a polytrauma patient? Urine output clinically the best method to assess the intake of the fluid in a polytrauma patient or otherwise in any other patient. Urine output is the best indicator. Insensible daily water loss, 800 to 1000 is a standard answer, should be known to all. It is answered only by 63% less than the other questions. It should be known to all. 800 to 1000 will be the insensible daily water loss in all. Most common blood transfusion reaction, febrile non-hemolytic transfusion reaction. These are all straightforward questions. Blood grouping and cross matching is must prior to infusion of, and this is one more important question to be known by all. It is answered by less number of people, 64%. So dextran is the right answer because dextran will be binding to the RBC membrane and blood grouping is necessary for this dextran transfusion. Rest all can be transfused without any blood grouping or cross matching. Next question, in these type of questions you have to know the diagnosis. You have to come to a diagnosis. He has given a female patient with dysphagia for both solids and liquids with weight loss and regurgitation of food particles. Barium swallow, he has given pencil tip appearance. So what is the diagnosis? Diagnosis will be achalasia. And what is the treatment option? There are many options, but he asked for the standard thing. So modified Heller's myotomy. Next question. It is a direct question. By knowing the dysphagia, regurgitation, foul breath and cough, which is present in a condition called Jenkins diverticulum, and bilateral lung crepitations were there. So he asked for only diagnosis. So that is the answer. All of the following give blood supply to the stomach except. So stomach will be supplied by multiple arteries coming from the celiac axis, and there will be a division further. So your answer is pancreatic artery. All of the following give blood supply to the stomach except. This is the pancreatic artery is the answer. So maybe some correction in the answer. Pancreatic artery is the answer, right answer, which is answered by 97%. Classification used for stomach carcinomas. There are n number of classifications. Among them, these are important: Borman, Lawrence, early gastric carcinoma, Sieverts. So how you will how at what time they are used, like based on what appearances. So this is a match the following type of question, new pattern question. Yes, one is the answer. 89.1% answered this question. An old heroine of 50 years. Here what we should know is diagnosis first. Diagnosis and the symptoms leading to the diagnosis. Here epigastric pain, and the pain worsens with eating food. So what will be with eating food will be seen in duodenal ulcer. It is wrongly answered by many students. So it should be known. Epigastric region pain and pain which increases after eating food. Duodenal ulcer will be the answer. Dumping syndrome is due to. This is due to because bypassing of the food content directly into the small intestines. That happens in some conditions like gastrojejunostomy. So that means presence of hypertonic content in the small intestine. So that will be the right answer. True about ERCP. What is ERCP? It is an endoscopic retrograde cholangiopancreatography with side viewing camera. False about Meckel's. Or no? True. It is a true diverticulum located in the anti-mesenteric border. So that will be the right option. But he asked about the false. So here he has given mesenteric border. That is the answer. It is equal in males and females. Next question. This is a direct question. Patient present with progressive hyperpigmentation, vision loss, amenorrhea. These are the classical features, classical clinical features seen in the pituitary adenomas. Nelson syndrome it is called as. A young lady advised for a surgery. So here he is asking about incisionless surgery. So all other surgeries in this HALS, SILS, HALS is hand assisted laparoscopic surgery. So there will be an incision. SILS, single incision laparoscopic surgery. In this also there will be an incision. In notes, it is a natural orifice trans endoscopic surgery, that is done through mouth or anal orifice. Here no incision will be placed on the patient, like in the abdomen or anywhere else. So this will be the incisionless surgery. An ITP patient was planned for splenectomy. So this comes from elective splenectomy, and he has advised for a vaccine. So vaccine prevents the infections of all the three: pneumococcal, H. influenza and meningococcal. So all of the above is the answer. A patient undergoes prolonged and complicated pancreatic surgery for chronic pancreatitis. Most preferred route. Here feeding jejunostomy will be most preferred, because here also alimentary tract is intact, and because it is a pancreatic problem, so duodenum should be avoided. So avoiding the duodenum, the best feeding mechanism will be feeding jejunostomy. An RTA patient admitted in hospital with pulse rate so 116, that is tachycardia is present, respiratory rate is 24, and PP is normal. So which stage of the shock? So shock can be divided into 4 stages. In that it comes to say second stage, because only tachycardia is present and BP is maintained. So 750 to 1500 ml loss will be a second stage. BP will be fallen only in the third stage, that is 1500 to 2000 ml loss of blood. Most common type of skin cancer, straight forward question, BCC. Plastic surgeon telling about the skin graft, splitting of the graft. The advantages are it prevents collection of fluid under the graft and prevents infection and prevents delay in healing. And this splitting increases the size of the graft. So both A and B are the answer. So here ends the surgery part of the test. All answered well, and only few bits were been mistakenly mistakes were seen only in few bits, and you have to read carefully the questions to find out the answer. All these questions are important in concept wise, and you have to know some facts as it is. Thank you.